Circumstance that happens. Yes. Okay. Bring the meeting to order.
We might do it once, I don't know.
Attendance, members, legislator Elaine Davey, present. Amy Sargent, present. Robert Shea, present. Thomas Winslow, present. I am present, so we are all here. I'd like to stand for I pledge allegiance to the flag of the United States of America, to the republic to which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. First order of business is the approval of October 10th, 2025 minutes. Yes.
I'll second.
Any discussion or questions about those minutes? Hearing none, all in favor?
Aye.
Any opposed? That passes. Thank you. I do want to note that on this agenda, there's just some typos. It indicates that it is the Wednesday, October 10th agenda, but it's obviously the Wednesday, November 12th agenda. But you're at the right place. We have some appointments that we'll be looking at the full legislative meeting. First of all, in the subcommittees for the Community Service Board, we have Megan Sidoris nominated for people with developmental disabilities subcommittee, along with Joyce McGlynn. Mental Health Subcommittee, Carol Colvin. So we will take a look at those later in the month. So we will go into department head meetings. I think, I'll follow the agenda this time. So we will have Deanna come up to report for public. Oh,
So here, is that okay?
whichever way is, I'll get this out of the chair or.
I'll come up and see.
Okay. And we do have a couple of public health resolutions if we want to move those along right now. We have HH1, which is a amended resolution. We passed resolution 27885, which is a create and fill for WIC through the help program, or a nutritionist help program, or a supervising nutritionist help through the help program. The amendment is authorizing the county legislature and the public health director to create and fill a women's, infants, and children's competent professional authority position, or a nutritionist position, or a supervising nutritionist position. The reason for that amendment is it allows the public health department, we did this with the DA recently. It allows them the flexibility to reach a broader recruitment audience for the position. So this is an amendment of a fill that's already been approved. It has gone through personnel committee. This is not a cut that is referenced in our budget, proposed budget. Do you have anything else to say about it?
Well, I'll move it for discussion.
Thank you.
I'll second for discussion.
Okay. Questions?
No questions. I think that was actually very accurate, Heidi. This came to the Personnel Committee. Deanna said that this is the only reason it's a create is because it's the help program. It's not brand new to the WIC. You're not increasing the WIC headcount at all. But you're finding that the nutritionist qualifications are pretty specific, and it's hard to potentially to get that. And these other two titles would suffice.
Correct.
So we recommended that you just amend the old resolution and give you the flexibility to do this. Still 100% funded in WIC. but you have more flexibility.
Yes,
to
and
look at-
adding the two titles, they're actually the same pay grade, but they're lower than the supervising nutritionist. So just wanted you to know that too.
Yep.
And it's all 100% grant funded.
Um, how can I phrase this? Bear with me. These are very different positions that we're incorporating in this resolution.
So I think where the confusion was is, so we had permission to fill from the original resolution for a WIC coordinator. And we had an internal candidate who took the WIC coordinator job so that she vacated the supervising nutritionist position. And that's what we were allowed to fill. And because we've been advertising for supervising nutritionist, we haven't gotten any candidates. So by expanding it to the two other titles that we have staff in those positions, we have one CPA on staff right now, one nutritionist on staff. We just want people in to do the appointments. We don't necessarily need that supervisory role. We'll take it if we can get it, but we can manage without it.
Okay.
Yeah, Diane made it clear that you don't really have the authority to fill behind unless it's the exact same title. That's why we have to come here.
And this would allow the flexibility of filling the need.
Yep. Yes.
Thank you.
Any other questions, discussion? Thank you. Hearing none, all in favor of HH1?
Aye.
Aye. Any opposed? HH1 carries. We have one more. And this is get through these lengthy. HH2 is authorizing the Director of Public Health to fill a public health educator or a senior public health educator position within the health department. Again, this was approved October 7th. They made a change. They actually are not going to fill, and this is part of our budget process, the Director of Health Education and Public Information. That was denied, but permission was granted to fill a senior public health education or public health education position.
I'll move it for discussion. This is a position that's been vacant for a long time because you guys got caught up in the hiring restriction, then it wasn't 100% funded, all of that.
Correct. Yes. It's been vacant since March.
Okay, and you've been advocating since March to, you need feet on the ground to get this position filled.
Yes.
This isn't 100% funded,
No.
but it is some funding
Yes.
through state aid and.
Well, we'll put the person on grants
Yep,
and we will also fund it through state aid. But not funding them 100% of the grant allows for the flexibility for them to do the broad work across all of the divisions of the health department, which is what we're lacking right now, and what we need. And then it's also going to create a secondary person for redundancy and public information for us. Because right now it's myself and the only other educator that I have at the moment.
and when you came to the personnel committee to advocate for the higher title position, and that got kind of waylaid, and that is one of the ones I think out of the tentative budget. You made the case that you did need people to do the program and to do the work. And the personnel committee recommended then bring this forward.
Yes.
What's the split about how much of it's funded through the grants?
Well, it'll depend on the grants that we have available to us, but I'm looking anywhere between probably 50 to 60, hopefully, on grants. And then the rest will be state aid. And then we'll see if we need to make adjustments moving forward, but.
Any other discussion, question, any questions from outside the committee? Hearing none, HH2, all in favor?
Aye.
Any opposed?
I have one.
Oh,
Sorry.
there are three, I'm sorry. The third one is regarding our rabies program. And I'm glad you found another contractor.
Yes.
This is authorizing the legislature and the public health director to enter into a contract with Megan Williams, DVM, for rabies specimen preparation services. And, just remember that this is a state mandated, a required public health program that we provide. Is it the rabies prevention, rabies tracking, et cetera. So we've had some trouble looking at that. NW rates off. Can I have a motion to put HH3 on the floor?
Oh, second.
Thank you. Any questions, discussion?
I can just add, so last month you approved someone to help us with our, the wildlife, animals. So the wild animals, this is for more domestic animals. And it just provides another opportunity for us to have, options for this level of work. We are actively seeking, additional contracts too, to see what we can get for what. So hopefully we'll be bringing maybe one or two more in December or January, but we've been reaching out to at least over 20 local veterinary offices and some wildlife trappers as well.
So I'm just curious, so they take the specimen or they board the actual animal during the quarantine?
So this wouldn't be boarding, this would be specimen preparation. This is the animal needs to be
Separate.
tested, yes. So we try to test the animals so that we don't have to provide rabies treatment to the individual who's been exposed, because that's more costly. So if we have the animal available to test, we prefer to do
That
that.
makes sense.
Is this a local vendor? I just wondered, is this doctor local
I'm trying
or?
to, yeah.
Yes,
Yes,
I'm
wow.
sorry, definitely local within the county or one contiguous county over. I
Mhm.
can't remember. I'm not the one soliciting these, but
Yep.
yes, I can find out for you.
Let's know. I just was curious.
Yes.
Good.
Any other questions for discussion? Okay. All in favor of HH3?
Aye.
Aye.
Any opposed? HH3 carries. Thank you.
I didn't have an opportunity to really put much information onto a report, but I did have some staff work on some year-end grant summaries, which I wanted to provide to you. It's double-sided. On the first page is lead, poisoning prevention. And so both of these are grants that help us do our required mandatory work. Lead poisoning prevention is something that we have to do to respond to poisoned children. And you'll see that plus sign, that is the newer grant that we have that allows us to do more proactive work to prevent lead poisoning from happening. So you'll see just for our caseload, the grant year runs October 1st to September 30th every year. We've been monitoring 64 active cases. 31 children's levels have decreased below our threshold, but they need a second confirmatory before they can be discharged. So we're still monitoring some of them. And we acquired 15 new children with elevated levels over the last grant year. Part of what we also do is we try to test children at their required 1 and 2-year-old well check visits. If their doctors don't do it, we try to accommodate them at the local daycares or at our office at our clinic. We tested 82 children. And then we have been working with doctors' offices to try to make sure that they have the point of care device so that children get the finger stick instead of the venous straw. That seems to be reducing barriers to getting kids tested. Another thing that we're really trying to do is educate our local community, homeowners and contractors about how to perform lead safe practices in their homes when they're doing work. So we've been able to offer with grant funds, 5 training opportunities last grant year. 3 were EPA lead renovation, repair and painting certification courses in which 26 attendees were trained. We held 1 EPA lead abatement worker in June and 1 EPA lead abatement supervisor in September. So we are doing this in an effort to get more capacity in the community because lead realm registry is going into effect. And we'll be talking more about that in the coming months.
Deanna, I just have a question. What's, for 64 active cases, is that on track with what you guys are used to seeing, or is that increased?
So this is pretty standard caseload since the threshold went to 5 and above.
Okay,
Yes, it was a big increase years ago when
Yes.
we used to not respond to kids until the level was a 10.
exactly.
But since the level has dropped, this is pretty.
Okay,
standard.
good. I was wondering.
Sometimes it's really hard to get that second confirmatory test and to really medically discharge kids. Parents just don't want to get the test or
Sure, can't get
they're
that.
like, why do I need a second one? I already know they're below the threshold, so.
That's 64, oh, excuse me, of the 82 children tested,
Nope, those are 2 separate numbers.
2 separate
Mhm.
cases or?
Yeah. The 82 children, I don't know how many of them were elevated, but they would have been a finger stick that would have been a confirmatory venous. So anytime we do a test, we have to confirm it if it's up above a threshold with a venous draw. So those are just 2 separate numbers. And then I just included some of the outreach that we've been doing. Our campaign is No Home for Lead. And you'll see like one of the postcards that's been mailed out.
Like medical methods work to bring a child's lead levels down?
Well, usually improving the environment that they live in, reducing the hazards that are conducive to poisoning. And then we encourage people to do proper cleaning of the home to remove the dust, washing children's hands before every meal, washing toys that are on the ground that could collect dust, and then a diet high in calcium and vitamin D.
Mhm.
And then obviously iron.
And it will actually abate the amount, so lead can move out of one system. then.
Yes,
Okay.
yes.
There's a chelation is hospital. What you
Yeah,
have to
chelation is
do
like-
when you really are severely high elevated lead, right?
Yes, yes, there is medical treatment, but that is very rare that we have to do that. And that is a hospitalized, like 5-day course of treatment that usually is not just one course of treatment. Usually they rebound and they have to go back for a second. So on the back page, I should just note, the lead report was compiled by Melissa Field, our lead program coordinator. I like to give staff credit. I think they do a nice job throughout the year. And then Megan McCall worked on the bike, pedestrian, and wheel sport safety final summary. That grant runs the same time frame, October 1st through September 30th. We attended and participated in over 20 safety events. We distributed over 200 helmets to children and made more than hundreds of kids safe. And Megan is the author of the Tale of Safety Joe book. Yes.
Mhm.
So she compiled this report for us. But most common, what people remember us by is the walk and bike to school days, and then our bicycle rodeos. But I included information about traffic gardens, which are a new thing that we're trying to do in the community. And there is one behind Play Space, and one at the Auburn High School's new preschool site. So
Like red lights, green lights, all that.
Learning how to.
Yeah.
a miniature
Negotiate.
roadway, like
Uh-huh.
village, town, so that children familiarize themselves with what they're going to encounter later on when
When
they
they're
get
on
older.
sidewalks and
Yeah.
actually biking in the community, yeah.
Age limit to that?
That sounds fun.
Why do you need it? No. I
Go to
just
Play
wondered.
Space, it's out
You
back.
go to the rodeo?
Yeah. Joe sets them up.
Yes, and Joe is really good about getting to all nooks and crannies of the county. And he does a lot with a very limited budget. So he's super creative. I don't really have too much related to my report, but I did want to update you all on that. At our October Board of Health meeting, we did improve an increase for some environmental health fees. And I think that would look to be around an additional $15,000 to $18,000 potentially in revenue. And we did most of our food related permit fees. And we're going to be looking at some other fees for the November Board of Health hearing or Board of Health meeting.
You're talking about increasing your fees to
The
increase
permit
revenue?
fees, yep, yep.
Uh-huh.
And we hadn't, those fees hadn't been updated in at least 5 years. So we did a comparison with what other counties were charging for those. And we determined that and presented that to the board and they agreed to increase the fees. I think that.
Thank you very much.
Yep.
All right, we'll go to Christine, who also has 3 resolutions. Let's take a look at those first. 884 is a resolution to accept CAPTA CARA funding and contract with the the county mental health center for a part-time behavioral health clinician who will be embedded in the child welfare services unit. This is an ongoing, this is not something new, it's an ongoing relationship.
So we've been doing this since about, I think, 2018, 2019. And it's been helpful to have someone with a clinical background available to the staff and services to ask questions about families that they're working with. You know, try to come up with a game plan on maybe some services that would assist them, but also to have the clinician be able to do some assessments for us.
Can I have someone put
I'll move that.
I'll second.
Any further questions about the work of the resolution? Hearing none, all in favor of HH4?
Aye.
Any opposed? HH4 carries. HH5 is authorizing the legislature and the Commission of Social Services to enter in contracts with various clinical psychologists to conduct clinical, parental, and child assessments for the child welfare cases. We have specific child clinical psychologist listed.
I'll move it for discussion.
Thank you.
Second.
So we do have two listed and this resolution will give us the ability to contract with any others that we're able to find. We don't use this very often,
Are
but
these court ordered? Or no?
yeah. when
They are
these
court ordered?
Yeah, court ordered. Up to $450 per hour is what the resolution would approve. For us to be able to engage services from, Dr. Colbrenner or Dr. Corn. We don't do, like I said, we don't do a ton of these, but, when we need to, when it's court ordered, it's nice to have them. You know,
Ready
right,
to go.
you know, that we are able to, you know, work with them right away and have them, you know, do the clinical.
So they're sort of helping the judge decide if there's
With parental
okay
assessments or
to come
child
home.
assessment.
Yes.
So it can be, you know, just if they're struggling with what's going on with the child.
Mhm.
It could be a parental assessment if we're looking at a child that was removed. We want to figure out, you know, what are the services that need to be provided to the parent.
Mhm.
Any questions or discussion? Hearing none. All in favor of HH5?
Aye.
Aye. Any opposed? HH5 carries. One more to look at. And that is the purchase of IT equipment. The resolution indicates that there are 10 laptops that have met their lifespan. And in consultation with county IT, there is a need for 10 laptops. This went through the purchase office because of the $7,500, it exceeds our $7,500 limit before a legislative resolution is needed.
I'll move it.
Thank you.
No second.
Any questions?
We worked with Jody on this. This is her recommendation for the number. She's got identified the machines that we have right now, the computers that need to be replaced, and Tom's aware the money exists in our budget for 2025.
Because of the threshold, you have to come here.
Yeah.
Okay.
I guess just confirming that as was worded in the resolution that, you know, consulting with our IT department was
Yes.
done.
Yeah, so Jody
Yeah.
Nickerson is the IT employee that works with DSS. So she was the one who made the recommendation. Tom Bunn also is aware and he approved, you know,
Right.
that number and.
Is technically Tom her supervisor? I mean, she's in your budget,
Right.
but he supervises her.
Under.
Yes.
Yeah.
So there's a specific whereas, Tom, that says, whereas in consultation with Cayuga County Information Technology, it has been recommended that the Department of Social Service purchase 10 laptops to replace aged IT equipment within the department.
Do we have a source or a process where we get these? What I'm looking for is like competitive bidding.
Yeah, so we do have a quote, that was something the IT department does. We don't do that. She knows what we need, what the specs are. They send them out to, get bids. And they selected, you know, this from the CDWG, you know, at a cost of $1,054 per unit.
And this cost after negotiations has been guaranteed for 30 days. So if we get on it, that is the cost that we'll be able to stick with.
Good.
Any other discussion or questions? Hearing none, all in favor of HH6?
Aye.
Aye. Any opposed? HH6 carries.
Yep, just have a couple of updates on the SNAP and HEAP front as far as the shutdown. The SNAP benefits, as I'm sure everybody here is aware, New York State has issued the full benefit amount to recipients that were currently open with SNAP, and folks started receiving benefits this past Sunday, and they're staggering them out based on criteria. So by the end of this week, all of the open recipients of SNAP will receive their full November benefit. Once that happens, they will move on to the new applicants that have been sort of held out during this process of the shutdown, and they will begin to process the amount for those recipients as well. So that's you know, good news. On the heat front, we still don't have a definitive date of when, what's gonna happen with heat. I think depends on what happens tomorrow. They have not released a date. So basically until the shutdown ends, we will not have any information on what to expect with an opening date for heat. Kind of in standby.
Is your staff on standby as well then?
Yep, well, so the staff have been working on all of the work to get ready for heat opening.
Right.
And have been doing all of the work with the folks that are on benefits and have the, you know, they qualify for heat just by being on benefits. That's been happening. New applicants are gonna have to wait until the opening date, so there's gonna be a lot of activity as soon as it opens, but you know, we're gonna monitor what's happening with you know, tomorrow with the government and see what's gonna happen with, you know, moving forward, because I think we're gonna have to make some decision if things continue to be delayed. The staff that we have at CAP, they're not gonna have anything to do if this continues to go on.
Nor will your contractor.
Right.
Yeah, yeah, I mean, you have DSS staff there
Right, so
and you have a
the
contract.
the staff that we bring on board and the contract staff, so
Mhm.
we're gonna be taking a look at this tomorrow. You know, and over the next couple of days to make a decision.
Is it likely, though, that when they reauthorize SNAP, they'll also reauthorize HEAP? Or
For when the shutdown ends?
Yeah.
That's my understanding, but it's gonna take a little bit for them to roll it out. I don't know the date that actually is gonna happen for the heat benefits to, you know, begin and for them to open the season. It's not gonna be the day the shutdown ends. It's gonna take some time.
you have human service examiners over HEAP? Is that their titles? Not the contract?
We have the seasonal heat clerks.
Oh, the seasonal HEAP clerks,
Mhm.
okay.
So we have, you know, embedded in DSS, at the DSS, you know, we always have our one examiner and supervisor. When the heat season open, we bring on board as DSS employees, two
Yes.
seasonal clerks, and then we have
35 hours a week because it's
Mhm.
half a year. So whether or not you'll continue to pay them or furlough them or do whatever,
Right, we have
yet to be decided.
Yeah. So we'll know more in a few days, I think.
Okay.
Beyond that, we have seen a little bit of drop in number again with our number of single folks that are receiving emergency housing. We're back down into the 80s, which is good news, 86 as of last Friday, and 16 families. We're seeing things
That's
kind of
less
spike
too.
up and down based on the weather. We're already in code blue. We've been, you know, having multiple days of code blue in a row. But still, we're not seeing a steep incline. So that's good.
I remember not so long ago when we were talking about 32 families
Yeah. Yeah.
within this year. So within this year, there's been
A drop.
a 50% drop.
Every now and then you do a snapshot of how many people have a known address from Cayuga County. Remember, there was this assumption that people were just coming in here in droves
Right.
out of county.
Mhm.
Maybe you could take a look at.
Yeah, so I did that in 2024, I
Uh-huh.
think. And that information that I received isn't something that we actually capture. I got it from the COC.
Oh,
So the COC was able to draw some of their information
Continuum of
down. It's a continuum of care, yeah.
Uh-huh.
They were able to pull down some information that we were able to, you know, we were able to see that,
Yeah.
like how people, you're talking about how people like moved from Cayuga
Mhm.
County to Onondaga County or Onondaga
Mhm.
County to Cayuga County and what that sort of looked like
Mhm.
over the,
Well, there was a general perception that we're serving all people that didn't have roots from our county.
yes.
And
so
that wasn't
yes.
totally true.
When there was a lot of discussion happening, yes, I did. And I had asked for that from the COC to have the numbers, have the kind of data to show what that looked like. That's not something that we,
Can actually easily do.
well, that's not something that I capture and have as like
Yeah.
data that I get every month or anything like that. So as far as like bringing that information forward, is that something that you would like me?
I don't think it tends to be true, but I mean, that's
It's always helpful.
committee, yeah.
You know, maybe an end of year 2025 overview. People are always curious about that. And I think the findings are always revealing.
Okay.
Thank you. And we, you know, you've got a lot going on. Wouldn't make it a priority.
Yes, right.
Please.
Don't stay late.
Yes.
Yeah, it was, yeah, okay. I'll have to go back and look at what we had before and see what information we got to kind of break it down to that level. Okay,
Thank you.
any other questions, Julie?
Any other questions on? Thank you. Christine. Okay, we have one more resolution in the mental health clinic, so I will have Lauren kind of come up and let's go through that resolution in your report. It's HH7. It is amending the mental health budget, 2005 budget to adjust state aid funding for contract agencies. The New York State supported federal and state aid funding programs for adults, children, and families with disabilities who reside in Cayuga County, and a stipend increase had been allocated to Unity House for their standard supportive housing. They're 100% state funds at the rate of $7,277. So we need to adopt them into the budget, increase that revenue line and also that expense line by this unexpected flow of money. Any other?
Nope, it's just additional state aid funding for their supportive housing beds.
Can I have a motion to put that on the floor?
So move.
Second.
Any questions? Discussion? Hearing none, HH7, all in favor?
Aye.
Aye. Any opposed? HH7 carries. Thank you. So we have a report.
Yeah, I have a couple updates. I just wanted I don't know if I talked about it here, but OMH came at the end of September for a very large meeting. They were doing this all across the state about they put out some guidance around changing some of the discharge planning guidance for hospitals. So they've done like community meetings for different areas in the state. So they came here and it was Oswego County and our county together. And there was a very large turnout, I think, for the meeting. I thought there was some really good discussions. Everyone had really positive feedbacks. And it's really about how can we partner better? How can we make sure the discharge planning meetings are happening when somebody is discharged from a behavioral health unit? Because OMH they have the licenses for the BHUs, but not for the ERs, right? So there's a lot of things that happen, a lot of moving parts. So I'm happy to say we've had some planning meetings with the hospital. We have a good plan, I think, going forward about how we're gonna make sure that we are able to do the discharge meetings with them. So we've created a standing meeting every Monday where we talk about our clients that we have in common that are on the BHU. And then we also talked about additional treatment plan meetings while somebody's there, maybe longer than, a week or a few days. That makes it a little bit more difficult to plan, but that they will be sending information, which they've been doing. I feel like this is probably the best relationship we've had when it comes to discharge planning, since I've been with the county.
Wow.
And it's been, a good decade or
It's a
more.
huge
So
step with the hospital.
I'm really pleased. I think we have really good relationships with the social workers over there, both in the ER and in the BHU. So I'm happy to say that I think that this push for the things to change when it comes to that, discharge planning is gonna be a lot better in our
So
county.
people aren't lost to follow up. Is that the whole purpose?
Yeah, I mean, I
of
don't
this?
know that people probably were, we were making, people were walking in and starting services,
Right.
but then there's sometimes not a great flow of information. Like, yes, we get the paperwork, but that doesn't say it all. I think having a conversation, talking with the social workers, having meetings gives us a lot more information about a client or a shared client that we have. Med adjustments that happen there that our providers need to know about. There's a lot of things that need to be completed.
Is the state helping with anything for kids? Because I know we don't have kid beds, so are they still sitting in the ER for days?
I think that's an area that we can definitely look at next that needs to be. Yes.
Yeah.
I think they do end up sitting in the ER if a bed isn't able to be found, or they're reevaluated and then they're discharged without really a great
Right.
plan.
Right.
Yeah, I think there's not enough beds, so that's what happens, is they sit there and then they're in an ER, which isn't the best place for them, and then they get reevaluated and they don't present as risky anymore, and then they end up getting discharged home, when maybe they really did need an inpatient stay.
Mhm.
The adults that go on to BHU in the hospital, you find they're mostly from your
There's a lot
clinical
of them.
services?
A lot of them.
Yes.
That are our shared clients,
Okay.
yes. The other agencies though are also working, we're all working collaboratively, like they're gonna kind of follow what we're doing as well with the other agencies that provide outpatient mental health treatment as well. So it wasn't just us that they met with, it was also the other agencies as well. So I'm hopeful that discharge planning in general.
Like
is
Cayuga
gonna go better.
counseling
Yes.
is the other.
And he
part of
still
it.
provides some
Uh-huh.
behavioral health services.
Yep.
I know that they met with them as well.
Great.
So that's one update. I'm not sure if I mentioned that, we do have a social worker that is part-time in the jail now. We had gone over a year without having that part-time person. We weren't able to fill it. So we eliminated the part-time position in the jail and we have a full-time therapist position at the clinic that she does part in the jail and part in the clinic. So I just wanted to make sure that I updated you that we did go, I think it was last July was the last time we had someone in that position. Because we just weren't able to hire for it, but we do have someone out there now and they're doing a lot of, they're working really well together and providing some different programming. So I'm hopeful that they really want to start some DBT groups in the jail, starting in January. Now they can do that. Now there's 2 of them to do that. So, there's a lot of really good treatment happening at the jail at this point.
Part-time social
Yes.
worker, you say.
Yes.
By splitting it, it's somewhat revenue generating because it's in the
Yes,
clinic
she's
too.
in the
That's
clinic, she
smart.
holds a caseload.
Yeah, that's
We have
smart.
talked about better transition planning for when somebody is released from jail, if they already establish a relationship with a social worker. That maybe she can also see them when they are released in the clinic, so that really can help. That relationship's already established and maybe, because we do lose people when they're released from jail too, as far as no shows and not coming to their appointments. So maybe that's a way to help with that.
And when one is incarcerated in jail, they do lose their health benefits,
They do.
including Medicaid. You can't bill for those visits.
Nope.
So,
We cannot skip over any of the services in the jail, at least at this point. There's been talks about changing that, but nothing has.
Yeah, I don't know what the way things are going now.
Yeah.
But that's smart to split it. So she is bringing in some, she's billing in the clinic.
And then our application has been submitted to OMH for the satellite clinic in Moravia School. We're just awaiting if they have any further questions, and the formal, contract after they give us our operating certificate. We'll be able to start that. We already have a therapist that's lined up that wants to do that work. And that's when we are able also to bill at 125% the clinic rate. And, certain districts are identified as a high need district, so we do get some startup funding with that, anywhere from 25 to 40.
Or are you one of those?
They are,
Mhm.
yes.
and the other clinics already established are Union Springs.
Union Springs and Weedsford
We-
are the 2 other satellites that we have.
Are either of them rated as high risk?
I'm not sure because we've already established them,
Okay.
so that it's
Right,
not
right.
associated with that anymore. I know that
Right.
we have presented it to Cato as well, so they do have an option. They are also a district that's in high need as well. It would just be up to the district if they wanted to do the satellite.
And they get, give staff there once a week or you
It
don't
just
have?
depends on what the caseload is,
Okay.
like, if, as they refer people and they get established, we will add time onto that as long as they're scheduled and seeing students all day long. If they have enough of a caseload, then we can justify that. And we do give, parents and families an option if they're already coming to the clinic, that they could transfer to the satellite if they chose to do so. It just has to be their choice. If they still want to see the same therapist and come to the clinic, that's also okay.
So these aren't just students, these are adults?
No, they're
only kids?
They're kids.
Okay.
So like if
yes.
the parents decided that.
It's not, it doesn't turn into an adult clinic in Moravia School.
I
Right.
mean, technically, you could see whoever you
Yes,
wanted in the
right.
satellite, but it is focused on the students.
Yeah.
Usually they like to get out of class, so they pick that, yeah, right?
It also cuts down on barriers, like it's
Yeah.
a ride to come into an appointment, you know?
It is, it's a lot. You gotta take them out of school and get them.
Yeah, yep.
Right.
And then I have one last update. I know I talked about the Medicaid 1115 waiver.
Yeah.
This is another opportunity to generate some revenue for our department. We met with him today from he's from what's called the Social Care Network for our region. And we talked about how we can contract with them to be able to do
Who's
some of
he?
the,
I'm sorry.
his name is John Bennett. He's
No.
from Flippa. It's
Oh,
the
okay,
agency.
the funding.
Yes,
Mhm.
so they were chosen as the region social care network. So we don't have a choice of who we work with. They are our regional social care network. So we figured out a workflow that we internally have worked out around doing social determinants of health screening and eligibility screening. So that's for anybody who has Medicaid managed care, to be able to tap into the services that are available, including housing services, nutrition. They can get groceries delivered to their house, they can get their apartments paid for, but they have to qualify
By
for the
this
service.
survey you do on them?
It's a screening, so like.
Screening, they get paid for.
Yeah, so we can get reimbursed for the screening, so we want to do that, as soon as possible, because there's not enough people in our county that is doing this work, and we're losing out on our people being able to benefit from the services.
So I know that there are some people in the community business oriented folks who are also interested in helping facilitate the opportunities from FLIPA. That there are some getting trained because they're not associated with you, or I know Cayuga Counseling Services has just initiated a big piece of this, even though it's outside their purview and mission. Are either of the agencies that are doing the screening able to get reimbursed for that when it's private volunteers who've been trained? But not.
You have to be connected to Medicaid, right? So it's all part of the funding. So if I'm sorry, I don't want to answer for you.
Go ahead. I'm not sure about
You know
that.
the
I
answers
know,
as well.
I don't know that you do. If you want to be a part of it, I think you can get onboarded to be able to.
Through the IPA?
Yes, through them, as well. But I mean, we would be the first county clinic to be able to, that's screened in the entire state, or at least in our region. Because government entities cannot receive any capacity dollars. That was specifically written into the waiver. So we can't get money for like a staff person to be able to dedicate to doing the screenings, but we can get paid for the screening that we do.
Are you having the care managers do it or the clinician?
So it doesn't have to be either of them. We're looking at having our intake people.
Oh, perfect. So yeah, you have to
That,
their license.
and, we have some other positions that we think that it can fit in some of their, job qualifications.
Yep.
So I think that it. would
And
work
if a person screens positive, then they get a referral to this particular open.
Whoever in our community, in this county that's providing that service. So there's like navigator positions that help them get to where they need to get to as far as the services, but we have some agencies that are providing the services that, like she said, are outside of what they really
Normally do.
normally would do, but
Right.
I think they really feel strongly that people need the service. So
Right.
they're gonna.
It's the only path. It's like figuring out their prescription for these social care. So they have to have it.
People qualify for prescribed meals where they'll get specific meals delivered to their home. Other people qualify for grocery delivery. Other people, and especially now, I mean, people could really use it.
Yeah.
They'll pay for someone's rent. They'll furnish their apartment if they qualify for certain things for up to 6 months. But again, we want to be able to sustain that beyond the 6 months because we don't want to have the same problem 6 months down the road. So they're very generous in the amount of money they give for rent, but we want to be realistic when we're working with people, right? We don't want to set them up for failure after the 6 months is over. But the whole point is to use this so that New York State can say, hey, we helped all these people out because of this. And because it does have an end date at this point.
Mhm.
We want to know, they probably want to know if this is something that makes sense for them to continue. So.
I did get, an email from the deputy director at Cayuga Counseling Services. And in one day for doing work, she had provided 2 people got into housing, prevented them from losing housing. 2 people were pulled out of hotels. One was a mother and a child who had lived in a hotel for a year. So doing the work is positive impact for these families, but it also will have an amazing impact on our services in the budget by taking advantage of FLIPA.
So I will bring a resolution forward to be able to contract with FLIPA. That's what that is about, is to be able to, for them to be able to reimburse us for the screening that we'll be doing.
That's primarily what you'll be doing, the screening.
Yes.
Yep.
There is a care management component, but I didn't want to do all of that at once. I just want to kind of start and see if that's something we can do down the road. Then that may be something we add on to our contract if we're able to.
But for now, start there. Yep.
And for anybody who doesn't have the FLIPA information, I can send you an email that came from me after a community services board meeting. They'll give you some good insights into what
All right, yeah.
it is and
Yes,
what
thank
they're
you.
doing. Yeah, I'll send.
And do you think this is one of the things that the state's gonna reimburse just to build it up and then they're gonna stop paying for it?
I don't know, people.
It's hard to build infrastructure for it when you don't really know what's gonna happen.
Yeah, I mean, everyone, people go either way, where
Yeah.
they think that it might be continued or some aspects of it might be continued after.
It sounds like HCBS in a different hat, right?
Yeah.
So,
But the states always do kind of like that, so we'll see. We don't know, but what we can do now is utilize, there's a lot of money.
yes, should definitely do that.
Utilizing it to help people, so.
Thank you.
Thank you.
Great report.
Yep.
Okay. I'm sorry to make others wait. Brenda. And Deborah, you can follow Brenda right away.
Okay.
So Brenda, you don't have any resolutions? So
Okay. So my report, I wanted to just update the first bullet. We are in the middle of Medicare annual enrollment. I come every year at this time of year and told you that it's a very, very challenging time of year for us because we don't have enough staff to meet the demand. And so this year, as in the previous years, it's ramped up even more. As of today, we've exceeded the total number of people we served last year through December 7th, at least, if not further. So we have 3 weeks to go and we already have more requests for assistance than we had last year. So it just keeps going higher and higher.
The aging population.
It is, and it's also the complexity of the insurance product, the Medicare product. The plans leave, plans change, the prices go up, the coverage goes down. And then people want to know, want our assistance to figure out what plan's going to work for them for next year. It's not a consistent product in any way, shape or form. So, we went through that a little bit when we did the demo and earlier this year. And anybody who has any medications that we really have to sit down with them and go through all those medications. It takes time. And I guess, the biggest issue that we're facing right now is that because we've exceeded the number of people, we don't have any appointments to give them. We have to let them know that we can take their name and information and we'll send it to the state, New York State Office for the Aging, who will then disperse their name and information to a handful of other state entities. I know New York State Office for the Aging actually had a number of their staff take on the training to get certified. So they're trying to help. There's some other agencies like Statewide Action, Statewide Agency, and some different ones that are also trying to fill in. But I can tell you, probably 80% of the people we offer that to are angry that we can't help them here at the county. They want to be seen right here in the county. They want to come in person. They don't want to talk to someone on the phone in Albany. So, it's hard for us because we want to help them when we just can't. We don't have the capacity. It's hard on our people answering the phone because they're getting the brunt of the complaints. So this just continues to be an issue. And I was actually a little surprised. I look back through years of reports and it just grows every year as an issue. So I wanted to bring that to your attention because I can't fix it. We have done everything we can. We've trained extra staff. We have streamlined the process. We're using the shared drive to record the callers and our staff are calling all the time that they can to set up appointments and do things. We have other staff who are sending out the intake form with the prescriptions. I mean, we have just looked at every possible way. And every year we absorb more and more. And we just can't keep doing it. It's just not possible.
Do you have any reason to believe the state doesn't get back to people or that people just wouldn't
People
prefer
feel
that?
lost in the system because they call us, then we keep a log till we have several people, then we send it usually once a week to the state is what they've requested.
Mhm.
So there you've got 5 to 7 days of no, they haven't heard anything. Then it goes to the state has to send the names out to whoever they're sending it out, they triage. It's a very frustrating system for individuals. Yeah. And, I do have to point out that the position that we've had vacant since May, the intent was to get that position trained in part to do this. We were hoping that by now we would have somebody trained to help. And we're still in the same place we've been right along since we haven't been able to fill that position. I have taken on, as I told you, the Medicare 101 classes for November, December, and January, no, October, November, and December.
Can I ask you a question, Brenda? If you did get the part-time position in the budget, would you most likely use the funding, the unmet need funding to fund that part-time or the New York Connects part-time? If that's what you're left with, a part-time employee, where will you deploy the resources?
It's the New York Connects money that we can't spend any other way. So if we have enough money for a part-time person with New York Connects that we can't spend any other way.
No,
So
but you
we
have money, enough money in unmet need, because that's how you're gonna do the other half of the position. I'm just curious.
We would like to, absolutely, 100%. We could have 100% covered position.
But if you could only have 0.5,
Mhm.
which would you,
We have to use New York Connects money. We can't do
You
health
can't.
insurance counseling with it.
you can't use unmet need money, which is what you were going to do for 0.5. I'm just,
Yeah.
I know it's not ideal, but I'm just
It's hard to
saying.
explain, Elaine, because I don't want to leave $40,000 of New York Connects money on the table for the state to take back.
That's what I'm saying.
That's what I would-
So it's a use it or lose it.
It is.
Okay.
And New York Connects money is very specific. So if we.
And there's no match on New York Connects money.
There isn't.
Okay.
So we lose $40,000.
Because you were going to try to do half New York Connects and half unmet need money.
Correct.
And the unmet need money was going to do the other half of the position to cover this huge need you have.
Yes.
So you either leave the 40 and it goes back, or you use unmet need and give yourself a half-time person for insurance counseling. I mean,
Right, and lose money.
Right.
Yep.
Yeah.
Right, that's where, that's.
It's not really a
our dilemma.
savings.
Our dilemma.
well, we'll talk it.
Yeah, it's very much needed. Yeah, and this is a position that we've had. But it's been a challenge to keep over the years. But it was 2019, when we first, asked for it. And, we have now the 100% funding to cover it. But from the county, from the state, so enough of that. The Medicare classes, I'm happy to do them. I believe this is something we normally aren't able to offer in October, November, December, all said and done. In addition to the 459 people that have already asked us for service, I'll be able to take care of an additional 25 people that we wouldn't have been able to fit in last year, at least, with these classes. So that's another way we're trying to meet everybody's needs. I want to piggyback a little bit off what Christine was talking about with HEAP. The HEAP program, a lot of seniors rely on HEAP. A lot of seniors have income limits at the level to qualify for HEAP. They rely on that. So when we get calls from older individuals, the unmet need money that we have, the really great thing about it is it has some flexibility when we have adequate funding. So we're able to fill in on some of these situations where we have a older adult who doesn't qualify for temporary assistance and would qualify for HEAP if HEAP was happening. And right now they have no furnace, it's not working. And so we've been able to help with some of those furnace repairs. It's probably limited in the duration of how many we'll be able to help and how long we'll be able to help. But this is one of the things New York State is trying to do, is give us some flexibility to pivot when there's a need in the community that's negatively impacting seniors.
And HEAP is no longer includes those furnace replacement and repairs.
So it's going to be an ongoing need. That's correct, right? Oh, I just wanted to mention here that our senior nutrition staff do a lot of work this time of year because of county holidays and federal holidays and Thanksgiving, Christmas, New Year's, all that. In order to make sure everybody has meals to cover all the days that the county's not open. In addition to also planning ahead for potential snow days and stuff. So they just put together a notification to the drivers, and it's multiple days where they're explaining, now on this day, you're going to take out 2 meals. And on this day, you don't need to come in because we're closed. But on this day, you got to take out 3 meals to the people so I just want to give them credit again for all the logistics they do to make sure that people get their meals. It is a really lot more complex than most people would realize.
We're remarkably blessed with these volunteers.
Yes.
If we had to pay for the service.
Yes, they couldn't be able to do
It'd
it.
be happening.
It wouldn't, right. Which leads me right into, again, we're still really in need of volunteers in Loch Moravia area, Summerhill area. Right now, we have people driving from Auburn to help cover those routes, which increases the cost, because of the mileage. So we really need to get more people down there, and we're working on that. And we did start this new, enroll in this newer program, Volunteer Cayuga, which allows us to be listed with multiple other entities in the county that are looking for volunteers. So it's just another opportunity to reach out to people that might be looking for a volunteer option. And that's really all I have.
All right, thank you. Any questions for Brenda?
Brenda, do you know, like for the kids that are like in honor society and stuff, if their parents drove them, does that count towards their hours?
Oh, we definitely have had that happen before. Yeah.
Okay,
Yeah.
so that might be it. We can ask
Maybe
around.
even just to fill in some of the routes, even if it was a short-term thing. Yeah, we've definitely had that. But they can't drive for our program, I think, until they're 18.
Right, but they can still participate and get credit. Okay.
Absolutely, yeah. Thanks. Good idea.
Great idea. Deborah, last but definitely not least,
Thank you.
thank you for your patience.
Oh, that's fine. I appreciate you letting me go earlier to pick up.
I really don't know why this order is here, it just is here. We can change it or something.
My report for today, I was just waiting to get some more information back. That's why I don't have anything on here, but as of today, all 14 programs that were funded in 2025 have been reimbursed, and I'm finalizing with all but a few are left, the program report summary that I have to do each year for each program that's due to New York State by the end of by the end of December. So I'm finalizing those summary reports for those 14 programs now. I was waiting for the RAP approval. RAP stands for Resource Allocation Plan. I did speak with my state representative today who oversees Cayuga County. She had a couple of questions on the 2026 programs, and I just have to clarify, put some more detail in. Other than that, we should be good to go. So I would expect a resolution in January for the 20 programs we will be funding in 2026.
20 program.
20 programs, yeah. We had 14 last year, so it's an increase. As far as something else going on with the New York State 250th Commemorative Commission, I did meet with Chairman Anna last week to talk a little bit more about that. There was a resolution I will be, the Youth Bureau will be accepting that money. And kind of the purpose of the funding is the fund should advance the commission's statewide plan by supporting inclusive history, civic engagement, public education, and commemoration related to the revolution. Allowable activities include countywide programming, exhibits, educator and student engagement, heritage tourism, signature events, and other locally prioritized initiatives aligned to the plan. So when we had discussed this opportunity, we have $15,000. I have reached out to, and I've been in contact with our county historian, Ruth Bradley, who actually has a group of the Historians Coalition of Cayuga County, the H3C, that's comprised of several town historians and representatives from the historical societies. So I will meet with her to develop some ideas and implement plans, as well as Cayuga County tourism. We thought one idea may be to do something similar that we do for the Youth Bureau, not a very strict application, but just give a lot of these entities applications, so to speak, so we could see how they would plan to use the money if it fits with the mission, and then do small awards based on what their plans are. The hope is to get funding to all the different communities within the county, and the legislators work with those contacts to present checks and things like that.
And students would directly be engaged in implementation.
Yes, that's part of the plan, is to have a lot of youth involvement. It's not required, but that's something that we think is important to do.
And that's why state has rolled it out through.
Yeah, because it came through, the money came to all counties. It's from the New York State Education. New York State Education gave the money out. So it's based on our census of number of students we have in our county. So according to that number, our $15,000 is based on our P through 12 enrollment of 8,747 students. So our county allocation for that is $15,000. And that's all I have related to the Youth Bureau. Has any questions?
Thank you.
Thank you.
Are there any other questions or discussions? Hearing none, I'll ask for adjournment.
Move it.
All in favor?
Aye.
So adjourned. Thank you, everybody. Thank you, department heads.